Live from the Scripps Studios, this is 10 News.
Tomorrow, the House of Representatives is set to pass the historic stimulus package. This as the number of cases of COVID-19 in the U.S. approach 100,000, with 1,000 lives lost. ABC's Marcy Gonzalez reports on the rise of cases expected to inundate hospitals across the country.
With a surging number of confirmed COVID-19 cases, the U.S. suffering its deadliest 24 hours yet. More than 1,000 people nationwide have now died from the virus, 13 of them in a day at this hospital in Queens, New York. Dr. Colleen Smith taking ABC News and the New York Times inside the heart-wrenching situation there.
Today is kind of getting worse and worse. We had to get a refrigerated truck to store the bodies of patients who are dying.
Also among the victims of this pandemic, a nurse at New York's Mount Sinai Hospital and a 17-year-old in Louisiana. That state seeing a 28% increase in cases overnight. Los Angeles bracing for a surge as well.
That if this rate of increase continues, in 6 days we will be where New York is today.
For a growing number of people, the crisis impacting their health and their livelihoods. Nearly 3.3 million Americans filing unemployment claims in a week, 4 times more than ever before.
They have to go back to work. Our country has to go back. Our country is based on that. And I think it's going to happen pretty quickly.
But the top doctor on President Trump's coronavirus task force saying this on CNN.
And you've got to understand that you don't make the timeline. The virus makes the timeline.
And the final vote on the $2 trillion federal relief bill is set for tomorrow on Capitol Hill, which would pave the way for payments to start going out to American families the first week of April. Marcy Gonzalez, ABC News, Los Angeles.
There are now 341 cases of COVID-19 in San Diego County. County leaders announced a third person, a woman in her 80s, has died from the virus. Today's numbers represent an increase of 58 confirmed cases. There are now 69 people being treated in the hospital, with 31 in ICU. Tonight, we have learned a sheriff's nurse at Las Colinas Detention Facility tested positive for the virus. County officials again stress the importance of social distancing and staying at home. Dr. Nick Ifantidis described our situation just days ago as being in the tip of the iceberg, and today he likened the 341 cases of coronavirus to a storm brewing.
That I believe we are still, in a sense, if you look at it from the viral storm perspective, we are still in the eye of that storm.
Supervisor Nathan Fletcher says the county is trying to fight that storm through their outreach efforts, and that includes the 211 line that people can call with questions about COVID-19, the installation of 300 hand washing stations, and passing out hygiene kits. $109 million. That's how much tax revenue San Diego Mayor Kevin Faulconer believes the city will lose by the end of June because of the coronavirus. And city leaders today said the impact on tourism and hotels likely means painful budgeting decisions are coming in the weeks ahead.
Hotels that were once bustling with visitors from around the world are unfortunately now seeing occupancy rates fall to single digits. And in some cases, they are closed altogether.
We'll be getting a lot of pressure from different special interest groups and that want to make sure that their funding isn't cut or isn't reduced. Those decisions are going to be very difficult, but have to be made.
And Mayor Faulconer also said today one of the city's lifeguards tested positive for COVID-19. All 170 DMV offices in California will be temporarily closed starting tomorrow. The DMV says this is out of concern for employees' health, and staff will be placed on paid leave for that time. They say staff will return next Wednesday after the offices are cleaned and disinfected, but all offices will remain closed to the public indefinitely. The U.S. Navy is working to prevent an outbreak at sea. 23 sailors tested positive for coronavirus on board an aircraft carrier that deployed from Coronado back in January. 10 News reporter Anthony Pura spoke with the wife of a sailor serving on the ship as the Navy begins testing everyone on board.
An unseen enemy is making its way through the decks of this powerful Navy carrier. The USS Roosevelt now docked in Guam after 23 of its sailors tested positive for the coronavirus. Navy officials say those infected will be moved off the ship. The rest of the carrier's roughly 5,000 sailors will be confined to the pier as they are all tested for the virus. Stephanie Hastings' husband, Chris, serves on board the ship, and though he was not one of the 23 infected, she says the situation is evolving so fast.
I'm sure he's worried. He was telling me he feels like he has a cold right now. He doesn't have a fever, but he thinks he has like a little cold, and he's scared. He doesn't know what it is.
The Roosevelt left Coronado in January for a 7-month deployment in the Indo-Pacific.
And I get worried because when he left for deployment, I went to Connecticut to see our family, and I'm still here. I've been scared to fly right now, so I'm worried if he goes home, I won't be able to be there with him.
It's unclear how the virus got on board. The ship's last stop was Vietnam about 2 weeks ago. The coronavirus cases began appearing on board earlier this week. It began with 3 sailors testing positive on Tuesday and quickly multiplying.
He said they were quarantining people that were in contact with the people who tested positive. But I don't even know how they would do that because, there's so many people there.
The carrier, though massive in size, has tight corridors and close sleeping quarters, making it a challenge to practice distancing and contain the spread of a virus. But Stephanie is staying positive.
The sailors are probably going to have really good medical care. If, God forbid, something does happen to more people over there, I think that they're in really good hands.
Anthony Pura, 10 News.
A candidate for Chula Vista's 4th City Council district has a dire warning for people experiencing symptoms of the coronavirus. Today, Andrea Cardenas announced on Twitter she tested positive for COVID-19. It's been 17 days since she started showing symptoms and 10 days to get the results. She's urging people to not wait for the test results, to self-isolate once you start feeling symptoms or if you've come in contact with anyone known to have the virus. And the chair of the Democratic Party announced he is discharged from the hospital after spending 6 days in ICU. Will Rodriguez Kennedy announced on social media he is now symptom-free and is discharged from the VA Medical Center in La Jolla. He's quarantined at a local hotel to allow his boyfriend and roommate the ability to remain quarantined at their home. A local nurse is still waiting tonight to find out if she has the coronavirus. She was tested nearly 2 weeks ago. Tonight, she talked to 10 News anchor Lindsay Pena about the changes she says desperately need to be made before things get worse.
So it's been 11 days since I was tested and still have no results.
Megan Usich is a San Diego nurse who still doesn't know if she has COVID-19. She just had a second test today in hopes of finally hearing something. And although she's frustrated, she says her case highlights a bigger problem.
And I'm hearing that from nurses across the country, that they're having symptoms, that they're concerned that they're infected, and they're not getting the testing that they need.
Usich says there's 3 main things she'd like to see addressed when it comes to medical staff.
A, do they have access? B, are they not being missed through screening protocols? And C, how long is it taking? Because if it's taking 11 days, that's 11 days you have a nurse out of the healthcare system.
A healthcare system that's already feeling the strain of the pandemic.
I don't think we're as prepared as we should have been for this.
Scripps Health CEO and President Chris Van Gorder tells 10 News one of the biggest issues right now is the amount of personal protective gear, like masks.
We have what we need today, but if our use increase, we call our daily use, and it will increase, our supplies are going to be very, very tight.
Usich says in addition to making sure nurses have the proper protective equipment, she wants to see administrators as well as local, state, and federal authorities streamline the testing process for frontline workers like her.
If nurses are at work sick, not only are they exposing themselves to patients, but they're also exposing themselves to other healthcare workers. And if we keep getting more healthcare workers sick because we're not testing people in the system, then we're just creating the vicious cycle.
Lindsay Pena, 10 News.